Intimate partner violence, or IPV, has many negative health impacts, including injuries and chronic disease. Cultivating partnerships between domestic violence advocates and healthcare providers helps to promote health and safety, ultimately expanding the support network for survivors and their children. When DV advocates and healthcare providers come together in collaboration, they can better promote prevention, improve trauma-sensitive response to violence and abuse, and streamline access to healing-centered care.
Domestic violence healthcare partnerships are so important because they increase access points to survivors. Usually by the time survivors seek out domestic violence programs, the abuse can be very severe. When health center providers have a relationship with domestic violence programs and understand the services provided, they can refer before the abuse impact is severe. Conversely, domestic violence programs can refer to health centers when medical treatment is needed, establishing a cross-referral process with an understanding of any limitation that may exist due to confidentiality limits. Three steps domestic violence programs can take to start building partnerships with healthcare providers are to become familiar with the health resources available and that are in close proximity. This helps identify potential health partners that support addressing survivor needs, as well as identifying training needs for advocates. Secondly, look for opportunities that facilitate the partnership, such as funding that aligns with both partners' missions, initiatives, and community needs. It is also important to participate in collaboratives, community groups, and policy work that support building these partnerships with healthcare providers.
Reach out to local clinics and ensure that they have your program brochures for their patients. Be willing to come and speak to their staff about your programs. If you're a DV program, reach out to medical schools and invite them to take a tour of your program. Work with them to look at their trainings and what support you can provide as an advocate to their medical students, and working with victims and survivors of IPV.
Across the United States, advocates and healthcare providers have linked arms to build and nurture creative partnership models, from co-locating advocates in clinic and hospital settings, to building systems for making bi-directional warm handoffs for services, and even establishing a hospital-based shelter. Like any relationship, partnerships may take time to develop, but they're easy to integrate and offer valuable solutions for staff and survivors.
We cannot do this work alone. We need each other to make a difference.